really excited to be here today. And Amy, in the introduction, you can tell that now I'm the Vice President for Housing Policy, but this is the first time in my career that I've had to pick a side. Normally, and the way that where my heart lies in this work is in this intersection of housing and health for people with, because so many people out of jails and prisons or in the behavioral health system, in the general healthcare system, they're falling into homelessness, not because of any fault of their own, but faults of the systems that are supposed to be trying to take care of them and help them be in a better place. And I couldn't be happier to talk to you today about racial equality and health and housing intersection. Can you go to the second slide, the next slide? So, and as the senator said, we couldn't be in a at a better time to talk about race, housing, and health. If 2020 has taught us anything, it's that those three things go together and are linked. And hopefully, what we can build is a day where it's not the inequality of that surrounds those three things that drives it, but how we've done such a great job learning from the lessons of 2020 and being able to respond and do better when it comes to racial equity, every people's health and meeting their housing needs. So today I'm going to talk a little bit about just affordable housing in general and the crisis at hand, and trying to because I think it's important to understand the magnitude of the housing affordability crisis, and because that's the only way that we're going to really truly be able to address it, rather than just nibble at the margins like we've been doing for so long. Then talk about the racial disparities in housing and health, the intersections that we've started to see over COVID-19, some health and housing partnerships that started to come together before the pandemic and that are hopeful that can serve as examples of how we can accelerate that work now that that we're in a crisis situation. And I want to end with a little bit of a charge for the future of what we need to do and the energy that we need to collect for the year to come. So next slide. So I wanted to start with this slide to explain what we're really talking about when we're talking about housing affordability. Often we think about housing affordability and homelessness, and that's it. But homelessness is the worst outcome of the housing affordability crisis. There are millions of families who are struggling, who are housed, but struggling to pay their rent, and therefore have to forego school books for their kids, seeing the doctor regularly, and eating healthy food. And this slide shows the magnitude of that situation, where you can see in 2001, where we start at level, and how even in the crisis of 2011, 12, and 13, rents stayed high and the gap between rents and incomes increased, but they never really went down to pre-2001 levels. And now we're in a point where and this is before the pandemic, as incomes had started to reach 2001 levels, rents were way up at about 13% higher than they were in 2001. And what I want you to take away from this slide isn't just the affordability gap, which is there, but the fact that people are working. A lot of the things that underline the way that we talk about housing, and like, oh, we just need to train people better or get them better skills and increase their income. People don't make enough money. So many people don't make enough money to be able to simply afford their rent. And without income, without making sure that people have a livable wage, the next thing we have to do is help people pay their rent. And that has to be, and we can't have underlying bias around that when it comes to work, because simply working is not enough to be able to afford the rent for far too many people. Can you go to the next slide? The other piece, as we're talking in an integrated space of health and housing, that's important for our healthcare friends to understand, especially, is that housing, federal housing assistance is not an entitlement. Everyone who is eligible for it does not get it. Not only does everyone not get it, only a quarter of people who are likely eligible, or of households who are likely eligible for federal rental assistance receive it. So that means 75% of folks who are eligible, and again, this is pre-pandemic, and we don't know what it looks like today, uh, don't get rental assistance, even though they would be eligible. And, I think that's one of the first calls for all of us, and especially our healthcare friends, to explain how egregious this is, and how if this were the situation in the healthcare space, we would be rioting in the streets. And so we need, one of the charges to all of us is to raise our voices about the importance of housing and the need to make it an entitlement for all those who are eligible. Next slide. So you take the affordability issues and the bias that we have in the way that we address it, and how inadequately we're addressing at least rental assistance support at the federal level, and layer on the long history of racism in housing, where we've created a situation that's allowed us to segregate people into communities that then we disinvest in and neglect. And that is, and books like The Color of Law by Richard Rothstein explain the history of redlining, and then locating environmental hazards, exclusionary zoning practices that have taken place, racist lending practices. And what's particularly important is when we talk about the history of racism in housing, it's important to understand that these discriminatory practices still happen today. You still see headlines in today about banks that have discriminated against people who are trying to buy homes in certain neighborhoods, or charged higher interest rates for people of color than they do for white people. These things may not have blinking red signs of no black people around allowed to lend money. We can't lend money to black people, but the results are the same, because they found other ways to be able to discriminate besides being so overt. And so it's important for us to understand that these, and now so it's important to see how these things resonate today, and recognizing that these aren't just things of the past. And I think, over the last 6 months, we've really started to come to grips with how unfortunately how much racism is not in the past and is still living out today. And housing is no different for that. Next slide. And so what we've seen then is this intersection, because where people live impacts their health. And while I pointed out the way that racism and discrimination have shown up in housing, the same is true in healthcare, where people of color generally report much poorer health across the board, with American Indian and Native Alaskans leading the way. But almost all people of color have self-report generally poorer health than their white counterparts. Next slide. And it's not only about reporting, but we see this show up in the data around around health measures. We especially for Black people, where Black people have a lower life expectancy, lower birth weights of babies, and higher infant mortality rate. And there are other, I selected a few examples, but there are other examples that show that that show the inequalities that also show up in the healthcare system. Next slide. So now what we've seen though now is that this pairing of what has happened, where people live and the options that they have in housing and the poor health outcomes that we've seen. Now there's a convergence of those things that we can see right in front of us as it relates to the current pandemic. You know, and it's not, as I said, it's not as if these things didn't exist before, but now we can see what usually we track over someone's life happen within a matter of weeks or months. That what the pandemic has just brought to light is how these disparities show up. And so from the COVID-19 crisis, and this data is from the CDC in August, that hospitalizations were worse for people of color. The death rates were also worse for people of color. Um, and um, and Next slide, please. And so, and why was this? It's from a lot of the things that we've all heard about what puts people at risk for COVID-19. That that where someone neighborhood conditions can relate to their asthma, can relate to whether they have asthma or respiratory disorders. And as I had said in the earlier slide, placing highways and not having green spaces all contribute to those sorts of things. Being able to, housing could improve people's mental health, but right now with the stresses of being at home, inadequate housing only exacerbates that. And housing has the ability to reduce incidents of alcoholism and drug abuse and family violence, but those are also things that we're seeing raised now because of COVID. And then there are larger health system concerns that health and housing partnerships can show us. That we've seen during COVID that people living in nursing homes or people in jails and prisons are overly at risk of COVID-19, and housing can help with that, and also in the long run help reduce systems costs. People being able to stay at home right now and not use crisis care is also another piece for housing and health. And one of the biggest issues, obviously, is for those experiencing homelessness, and their ability to shelter in place right now is, and the role that housing and health connected together can help, especially those with chronic health conditions, stay safe, get the treatment they need for their current conditions, and stay safe from COVID-19. Next slide. And so, so for the health, so as I was saying, for the health system, I think the other piece is just understanding all of these places where housing can impacts all so much of the outcomes in the healthcare space, and understanding that it's going to take some intentional partnerships. And luckily, before the crisis, we were starting to get into a place where health and housing was cool. And now I think we can learn more to accelerate those things. So next slide. So some of the things that we were seeing before the pandemic were managed care organizations understanding, especially in expansion states like New York, that we're understanding that now these vulnerable populations were their folks too, and trying to figure out how to adjust services models like they were doing in Texas and Arizona and Louisiana to match with housing, to help people in housing. Managed care also, which is really important, there's a financial investing piece into housing. So housing, I've talked a lot about rental assistance in housing, but in places, especially like New York and other large cities, housing supply is an issue. And managed care organizations have figured out, okay, well, maybe we can't make as much of a return on our investment as we could in the general market, but we could invest in tax credit properties to get a little bit of a return on our investment and increase or improve supply. And several managed care organizations have been doing that, especially in the last 3 to 5 years. Hospitals we're starting to do more, and I can see where that will also accelerate. Um, Hospitals, nonprofit hospitals have a community benefit program requirement that they have to meet, and then to invest in community. And oftentimes they're investing in services, but more often lately they've been investing in housing. Places like Bon Secours Hospital in Baltimore is always lifted up as an example, and so is Nationwide Children's Hospital in Columbus. Both invest, both have housing stock that the hospitals have invested in that has been doing significant work to rebuild communities. And the last piece is around service providers and trying to link the primary care system and the behavioral health care system to either help people experiencing homelessness and make sure to wrap around the services around them in housing, or trying to prevent hospitalization or prevent homelessness by identifying people who are frequent users of emergency rooms, like they've been doing in Camden, New Jersey for so long, and wrapping services around people in their homes to help them stay safely housed and out of expensive crisis care, when that's appropriate. Next slide. So those are things going on before the pandemic and before the racial justice awakening that we've had over the summer. Now that we're really seeing that we've got to make not just these small changes and small partnerships, but really transformative change to how housing and healthcare systems work together. It means that we've also got to intentionally reverse the negative impact of racism. And the first thing that we have to do about that is disrupt the racial bias that exists in both of the systems. You know, research, starting from a good place of the civil rights movement and wanting to make sure that we're not segregating Black and brown people needlessly, then has led to decades of research that over and over again tells us that it's bad for Black and brown people to live next to each other, and that when that happens, bad outcomes happen, which then makes people wonder, okay, well, how many Black and brown people in a neighborhood are too many to live there? And that is wrong. That is the wrong thing to be thinking about. But it's ingrained that there has to be a proximity to whiteness for Black and brown people to do better. And we have to disrupt that and explain that it's not that it's inherently bad for Black and brown people to live together. What happens is that when Black and brown people do live together, then policymakers can make decisions that discriminate against them. And that is what leads to the bad outcomes. It's not inherent to any of us who are people of color to automatically have bad outcomes. There are intentional decisions that go into that. And so once we realize that as housing and healthcare systems leaders, we need to then reverse that and start to invest in those communities and figure out what works and not abandon them. The second thing that I want to make sure to call out in this space is that that we need to look at our programs and policies to look for the ways that they perpetuate racism and unjust outcomes. How many hoops do we ask families to go through before we give them the housing or healthcare services that they need? Do we tell them that they have to work or have to go to school or have to do training or have to do something in order to deserve housing or healthcare? Those things, that's why I led with the slide around income. People are working really hard. There's nothing about the feeding into these narratives about people being lazy, and that's why they don't see their doctor or don't or can't afford a place to live, is just harmful and self and defeating for people who are working very, very hard. So how can we reorient our programs and policies to help to just simply help people afford the things that they need, and do it in a way that's as easy as possible, and allows them to save money and not always feel like they're behind. The last thing is, we always talk about the hardest to serve, and that does put another stigma and burden on people who simply just need some extra help because of the way our systems are designed. So we need to have our mission to help people with the lowest incomes and not see it as a burden to have to help people that are that might be the worst off, but as our calling. Because until we fix the things that are hurting the people with the most complex conditions, we won't be able to do we won't be able to get the work done. And in our from my perspective at the center, a lot of that is around rental assistance and just simply helping people afford a place to live. As I said before, most people who struggle to pay their rent aren't have a place to live. They just are struggling to pay for it, or it's not a very high quality. And so if we can just help them afford their place to live or help make that place better, then we're doing a lot of the work. It's not as if we have to create necessarily a lot of new units, because so many people are actually are housed. Next slide. So that, I just want to wrap up with that call that we really have to look inward into ourselves about what are the services and supports that we're giving people, and recognize that, you know, we may all be doing work of serving those with the highest need, but we can't assume that what we're doing is reversing racism or is anti-racist, because if it were, we wouldn't have the disparities that we do have today. So we have to be willing to look at what we're doing to perpetuate racism and discrimination and the housing affordability crisis and the healthcare poor health outcomes, and fix it, and just and recognize that even those of us who think we're good people can be making mistakes, and because we all are making mistakes, and so we're all trying to do better. And so my charge to all of us is to lean into that, and know that we can't do better without changing, and that's what we've got to own and do moving forward. Thanks, Amy.
Thank you so much, Peggy. I love that. You know, it's the call, can't do better unless we change. Thank you so much for that really inspiring talk. I want to encourage people to type in your questions in the Q&A for Peggy, please. I have a couple of questions to kick us off. So we know that racial disparities in housing are at the root of racial disparities in health outcomes and in access to quality health care. And, you know, over the past probably, I don't know how many years, 5 or so, healthcare systems are increasingly talking about and interested in addressing social determinants of health of their patients. So I'm wondering what you think are some effective ways that healthcare systems can have a positive impact on housing, whether it's housing stability, affordability, quality in the communities.
So I think one of the big ways is to start working out data arrangements with the homelessness and housing world. You're recognizing that first that we're all here probably likely serving the same folks. And if we aren't, then what's going on? Why aren't folks in the homelessness system showing up within the healthcare systems, especially when we're talking about healthcare systems that includes clinics and hospitals? It's not just one location. So being able to share the data and see what is a first step. Then I think it is that looking for the ways to invest in the community and opening up the doors of the hospital or the healthcare system to make sure that the basic services are, are truly patient-centered, client-centered, and not just saying that they're patient-centered or client-centered, but truly owning that, engaging the community in listening sessions and hearing what their challenges are, so that you can truly be patient-centered and not just what my idea or your idea of patient-centered is, but really what your patients are saying. And then, then the next, those two things I think are really at the heart of what the healthcare system in particular does. But, going into the next step is what to do in the housing space. And what I tried to show is that the affordable housing crisis is big, and the healthcare system isn't going to solve it. And I don't think should try to solve it on their own. So that's the other piece, is partnering with the housing world as advocate partners, explaining the role of housing and why there needs to be increased housing resources, figuring out ways to help with maybe short-term housing assistance, to be able to there are things, like first last month's rent and things like that sometimes can, furniture, things like that can sometimes, paying arrears when people owe back rent somewhere else and are trying to move. Those sorts of things can be hard for the housing world to figure out how to get the resources to do. And so, as a partner, of a fundraising partner, as a partner who can contribute to some of those things, those are the things that the healthcare system can do. But I think the biggest thing is joining the housing world as advocates for significant increases in universal rental assistance for people who can't afford a place to live.
I like that. That's it's a great idea. I hope everybody's taking notes. So one other question, and then I'll turn to some attendee questions. So as you mentioned, and as I've heard you say elsewhere, because the policies, we have policies that have played a role in creating disparities, we need to be looking for policy solutions to correct the disparities. And that if progressive policies were already doing this, we wouldn't be in the mess that we're in now. So I'm wondering what kind of policy innovations you'd like to see the new administration in Washington take on to really move the needle towards greater racial equity in health and housing. Like maybe what would your first 3 steps be that you would want the new administration to take?
So one of the things that we've been that at the center we've been exploring, and a program that maybe the healthcare world doesn't know as much about, maybe even a lot of the people on the housing side don't know about, is called the Family Self-Sufficiency Program. And there's also a similar program called Jobs Plus. And these two programs work in the rental assistance program and public housing and help families save money as their incomes increase. They do it in different ways, but that's the theory. Just to keep it simple, they both help families save money as their incomes increase. Because in the rental assistance program, as your income increases, you pay more of your rent because you're paying 30% of your income, and then the subsidy pays the rest. So then, as your income goes up, your rent contribution goes up, and the rent subsidy contribution goes down. Well, obviously, that makes it really hard for families to save money, and it can create some disincentives toward the end if you're worried about losing your rental assistance, because of maybe a smaller increase in your income. But along with these programs are the tenant has to enter into a plan of how they're going to make more money, what job skills training they're going to go to, what other what are they going to do to deserve to be able, the privilege to be able to actually save their money? And so this gets at one of the things I was talking about in the talk, is maybe the thing to do is to shift some of these services programs that are trying to help families, but are always contingent on the family jumping through hoops, and reorient it to a wealth build, to create wealth building programs, right? So that families can save their money, say as their income goes up, what would be their rent contribution goes into a savings account, right? And, but that just is, that's it. We're just helping the family figure out how to help save money, because if my income goes up, it's my choice whether my household costs go up. It's not fair that low-income families can't do the same thing. I would say the other piece is, is just increases to the federal subsidy program. The fact that only 25% of eligible households receive rental assistance, federal rental assistance, is ridiculous, and we have to do better. Because then all these things about health and housing and the importance of housing is just that. It's just words if we're not going to do better to make sure that people have a safe place to live. And the last bit, I think, is thinking about the supply side, particularly for places like New York, and the public, and particularly public housing in New York, right? Trying to figure out how to invest in the housing that exists so that we preserve public housing, we create a safe place for people in public housing. As the senator said, far too many people are sick because of the housing that our tax dollars are paying for. We've got to figure out how to do better on the supply side.
And I guess sort of to round out that question, like how optimistic are you that we might see those kinds of efforts coming out of the federal government in the coming year?
Well, hopefully, the case that we can make about housing being part of recovery and economic recovery is seems like it would be clear now, especially as it relates to COVID. So it will be important it won't happen if we all don't join in the fight, and if we just cross our fingers, that's not going to be enough. So I am hopeful because of events like this that are calling attention to the need for more investment in housing, and the chance that I have and my colleagues in DC have to ask you to join us in the fight so that we can get more rental assistance. But there are things like the budget caps, the appropriations bills that have moved through Congress won't be capped in the way that they have in the past. It's not like there's going to be unlimited spending, but at least the lifting of the caps allows for some more conversation around investments. And then obviously, and then depending upon what happens in Congress, the ability to move major pieces of legislation is dependent upon elections in other states that aren't New York, unfortunately.
So that's I guess that last one, the wait and see. We'll have to wait and see. Okay, I'm going to look at what kind of questions we have here. So one person asks, could you also speak to the discrimination of people with histories of incarceration who are sometimes screened out or seen as less deserving of supportive housing, and just sort of that they have additional barriers to accessing stable housing?
Yes, yes. So that is all true, and it's also the fact that it doesn't have to be that way. In 2016, at the end of the Obama administration, HUD released guidance on how housing agencies should handle people with involvement in the criminal legal system. And we've taken some steps back from overseeing that to make sure that housing agencies are being fair and doing and not being overly restrictive. And I think that that's something that we should be raising up and calling to the new administration to go back to that 2016 guidance and lift and make sure and put it front and center as a part of the oversight of housing agencies to make sure that we're looking how to get to yes for people that are coming out of the criminal legal system, then always automatically saying no, because as you said, then there are also fair housing implications to that, which were pointed out in that 2016 guidance, given the overrepresentation of people of color in the in jails and prisons. If we're overly restrictive of people leaving jails and prisons, then we're going to be violating fair housing access also. The other thing I think to think about in New York is there are efforts that have happened to try to work on strategies to do in-reach into jails and prisons. One of the things that I had the opportunity to do here at the center was to go on some state tours of prisons and to look to see how they're connecting people to services before. And housing is the thing that never ever happens. And I work in DC in the Beltway, and I'm not I feel like social workers and case managers are like the salt of the earth people, and I am too soft-hearted to be able to do the work that so many of you do. And this was an example of that, because watching the case coordinator talking to the inmate about where they were going to live when they got out, and the inmate seriously not even knowing if their parents were going to come pick them up, and they were like 21 or 22 years old, and being able to look at them and know that they were going to end up back, like the odds were good that they were going to be back here in the same spot 2 years from now having the same conversation, was heartbreaking. So we've got to do more to figure out how to create housing available for people prior to release, so that they can start on day one having a safe place to go.
Yeah, thank you. I was just, this was reminding me that I saw a post that Ibram Kendi had on Instagram, I think it was yesterday, about how the US has proposed that corrections officers and other prison staff receive priority for coronavirus vaccine, but not inmates themselves. And so I think that's, that says a lot about how we think about people who are living in prison. So one person wanted you to repeat the name of the two programs that can help families. I think one was Jobs Plus.
Oh, yeah, Jobs Plus in public housing, and then the Family Self-Sufficiency Program.
Family Self-Sufficiency, and that's a federal program.
They're federal. Well, so let's see. So so Jobs Plus is federal solely. FSS, there are grants that housing agencies can get from HUD. There are also some mission-driven multifamily housing providers that operate FSS programs in some places without federal funding. They do it solely, and so that's actually a place for investment of, if there are philanthropic partners on the phone, or healthcare folks who are looking for ways to help housing agencies, looking at those that deliver that aren't housing authorities, that are just multifamily mission-driven affordable housing buildings that provide FSS, and are looking for fundraising opportunities to keep those programs going.
Great, thank you for that. One other question is, how do we convince hospitals to partner with housing advocates, or what kind of levers are there? Leverage? How do what sort of messaging for those of us sitting in healthcare who want our systems to do that work? What kind of suggestions do you have?
Well, I think the first thing is to not go to the hospital and ask them and tell them that they're supposed, or the health system, and tell them they're supposed to end homelessness, because homelessness is not the healthcare system's job, and they're not going to understand what their role is. So the thing is to figure out what's important to the hospital or healthcare system that you're trying to get into, or that you're working within. And then connecting that issue to homelessness or affordable housing. So if you're in a meeting in your healthcare system and they're talking about the people with behavioral health needs that are always sitting in the emergency room, you're like, hey, have I got a fix for you? You should engage the homelessness system and the housing system, and we can help get those out of that emergency room. Too often, especially, the conversation with healthcare is a cost conversation, right? And yes, that leaves a lot of people behind. But if cost is the entryway into the conversation, then that's the one that we have to take, and then start to tell the stories of the people that we're able to help. The other thing that I've seen, that I've done and seen work, because because the housing side's talking about housing and the healthcare side's talking about healthcare. Sometimes the healthcare side doesn't understand the underlying health conditions that we're taught that people have. So they don't. They're thinking we're trying to solve for homelessness. So if you take like a profile of, especially the housers, if you take a health profile of the people in the building or the people that are trying to get assisted and show them from a health perspective to the healthcare system, that can all of a sudden show a light bulb that we're talking about the same people, and trying to get to the same solution. The last thing, though, that I would say is, I don't think it's important to spend too much time trying to align goals. I think the time is spent better aligning solutions. Everyone can have their own individual system goals that they're trying to accomplish. It's recognizing that the solution at the end accomplishes everybody's goals. That's reorienting that way, because I feel like sometimes we spend too much time trying to all get the words of the goals to align so we all see ourselves in it. And I don't care that the healthcare system's job is to save money. If I want to house people, will housing achieve the goal of housing people and save money?
That's great. Yeah, that's great advice. I already feel like I want to listen to our conversation because I can't quite absorb everything as we're talking. But one just last question before we go, and we're going to take a 10-minute break before we come back. What keeps you hopeful? Like what keeps you optimistic and hopeful these days?
Well, it used to be being able to go to conferences like this and see people and hear the great work that's happening out in the world. I think right now what keeps me hopeful is that we're able to name the things. If the last 6 months since George Floyd's death has done anything, it's empowered us all to name the thing, to name racism as a problem, to name, and to just start to call these things out. Because what I have realized over the last year is that it is, in last 4 years, frankly, is that it's a lot of keeping things quiet that made it seem like everything was good. And so, so getting the energy to just name the things and name the racism in the moment that you see it has actually been a very freeing thing lately. However much it might be hurtful or cause a little bit of tension, it has helped us move the conversation. The same thing with racism and health and housing, and trying to get to better outcomes. Since we can name reversing the negative outcomes of racism as the thing we're trying to work to do, then now we can have some intentionality about what we're all here to do, and not talking in euphemisms and ignoring the elephant in the room.
That's great. I think that is, we're gonna take a break now. Thank you so much for all of your words of wisdom, Peggy. Really appreciate you being with us here today and sharing your wisdom. And I hope everybody is able to take something away from today. Just really appreciate you joining us today.
My pleasure. Thanks, Amy.